Hello, I'm John Makin, head of the DDU. Thank you very much for watching this short video. For many years, the DDU's been committed to supporting foundation training. We recognise the robust selection procedure that education supervisors and training programme directors go through, and the contribution to risk management that they make. And that's one of the reasons we offer reduced subscriptions to those groups. Now, we do appreciate how daunting the transition from undergraduate training into foundation training can be for newly qualified colleagues. And we have a wealth of experience within the DDU to assist at any stage of your career. And with that in mind, I'd like to introduce a couple of my Dento legal advisor colleagues. Emily Howden has very recent practice and foundation training experience as an experienced Dento legal advisor, and Eric Eason is still in general practice in high street practice. So we're going to explore some of the issues that might be on your mind as you make that transition from from undergraduate training into foundation training. So if I can start with you, Eric, first, how does the undergraduate teaching program and the principles of that program prepare for the start of foundation training?
During undergraduate training, you're taught all the individual aspects of dentistry, all the technical aspects you need, and then you're taught to put them together in your fourth and fifth years. So by the end of fifth year, you're developing treatment plans for the patient, gaining consent, etc., and then developing the actual treatment plan you're going to deliver. So that translates into general practice because you have one patient in your chair. They might need multiple items of treatment that fall into different disciplines, and you're providing all of the treatment for that patient. So it helps you develop treatment plans, gain consent from patients, and say it really helps you put it all together and make sure that the patient is happy with the treatment you're going to provide for them.
Sure. And Emily, how does that translate into the things that you've seen with newly qualified colleagues coming into foundation training practices?
I mean, I think it's building on those skills that you've already got from dental school, and it'll be developing those throughout the year, and really sort of being eager to learn and to develop the skills you've got and learn some new ones along the way.
Sure. Eric, what can recent graduates do to make sure they're prepared as they can be for starting in practice? Obviously, there's a bit of a lull between finishing the undergraduate year and starting in the foundation training practice. Is there anything they can do to accommodate for that?
Yes, I mean, particularly this year, it's slightly longer between finishing your undergraduate training, and as I say, you may not have treated patients for quite a while before you go into practice. So there is that lack of confidence from things, and something that will give you confidence is reviewing all the course materials you were given as an undergraduate, particularly things you may not have done frequently in your undergraduate training, things like crown preparations. You may have done a few, but really it's like making sure you're aware of all the different stages and make sure you've got it really drilled into your mind of what comes next in those different things. So that will give you confidence and reduce anxiety and stress levels in particular. One of the other things is finding out what materials the practice have available for you, because it might differ greatly from what you've been using in the dental hospital. There'll be the same general group of materials, but they might have different working times, etc., particularly for things like impression materials. So you need to find out from your educational supervisor what they have available, look at the manufacturer's instructions and make sure you're aware of what is available, so you can ask in the first few weeks, you know what to ask for nursing wise, and you can get up to date with everything.
Yes, good advice. Emily, how do you think the educational supervisor and the practice are likely to be preparing for the FD's arrival?
Well, it's always an exciting time for the practice when the new foundation dentists start. And I mean, the practice will be looking forward to welcoming the foundation dentists. They'll be preparing the surgeries, they'll be organising the induction, looking at the appointment book, and generally, they'll be wanting to make that transition from dental school to practice as easy as possible, and they'll be wanting the foundation dentist to settle in quickly.
And with that in mind, thinking about the start, Emily, you again, if I may, how can FD be sure to make the best impression that they can when they start at the practice?
I mean, I think it's important to be professional. So being punctual and smartly dressed will obviously create a good first impression. I think it's important to get to know all the members of the dental team. These people are going to be your colleagues for the next year, and some of them may become lifelong friends or mentors. So if you can start to develop those professional relationships early on, I think it will really help that transition, and you'll be able to share ideas and learn from everybody in the dental team. And if you understand how the practice is operating, you'll be able to settle in more quickly.
Thanks. Eric, on a practical level, what sort of things do recent graduates need to make sure they have in place before they commence their foundation training position?
The NHS applications, you'll be requested to put down two people to give references to your referees. Make sure they have agreed to that, and make sure they're aware that they are going to receive a request for a reference, because they often contain attachments that can go into junk emails, and it causes delays. And it can cause all sorts of problems if those references aren't completed on time or quickly. So that's one of the first things. The other thing is the application to join the dentists register with the GDC. That's one of the other things, and indemnity as well. Joining an indemnity organisation. They're all sort of very important things to consider, and preferably the DDU.
Indeed, that's exactly right. And Emily, in terms of, Eric's mentioned referees there and things, and I think that goes to the professionalism point that you were making earlier, isn't it? It's professional courtesy to let your people agree to be a referee, to let them know that there's communication likely to be on its way. Once the FD, well, even before perhaps they arrive at the practice, if they're concerned about a particular procedure, let's imagine they're worried about extractions or molar endo or something of that nature. How would you advise, Emily, that they deal with that in terms of speaking to the educational supervisor or whatever?
I think it's really important to have good communication with your educational supervisor. So if you've got any concerns or worries about any areas of practice, it's best to speak to your educational supervisor early on, and then together you can develop an action plan and start working to improve those areas. Your educational supervisor is going to be an experienced dentist with a wealth of knowledge, and hopefully they'll have tips and ideas that may help you, but they'll certainly have strategies in place that can be used, shadowing somebody else in the practice, or tutorials on a particular topic. So I just think it's important to talk about the concerns you have early on, and then you can start to address them. Try not to shy away from those areas that you're worried about, because this is a great opportunity to really learn more and develop those skills, especially those areas you are worried about.
And that's the temptation, isn't it? We're all human, and we tend to focus on the things we like and we're better at. And training needs analysis probably focuses on the things we're least good at, and therefore that's where we need the input. And I guess to make the most of your FD year, you've actually got to look at the hard stuff first. Eric, if I was to ask you to sum up really in a sentence or two your top tips for that transition from undergraduate into foundation training, which I know you've experience of as well, what would you say?
Refreshing memory, because of the time lag between finishing your case patients then going into practice. So refreshing memory on the actual techniques and sequence of events. Materials going to the practice, because it can be daunting with lots of different names for materials, lots of different manufacturers, lots of different working times. Just make sure you are aware what the practice have, because again, it does reduce a lot of your stress when you're actually providing treatment. If you didn't know what glass anatomy you have available, or what impression materials and the working times for it when you're actually providing treatment, it can create panic. It then impacts on your time management. It causes great difficulties, and it reduces your stress knowing all these things before you start. One of the other things I think it's important for undergraduates to realise is the social media aspects, of making sure your privacy settings are appropriate, because you are going to have lots of people searching for who you are. a greater number of people doing that than you have as an undergraduate, because you're coming into contact with lots of patients, lots of staff members. So making sure you are restricting access to people who you don't want to see your own personal information.
It's a very good point. Thanks, Eric. Emily, again, a summary from you, couple of sentences.
I mean, my advice is to really enjoy this year. There's going to be so many opportunities to meet new people, develop the skills you've already learned at dental school, and new ones too. So I think it's, you know, wherever you are in the country doing your foundation dental training, you're going to have a great time. So really enjoy it. And if you go in with a good mindset, you know, you can learn quite a lot. I think the other important thing is, you know, remember that if you do have any concerns or worries, speak to your educational supervisor or your training program director, or even here at the DDU, we can take calls. So yeah, if you have any worries, I think it's important to talk to people early on.
That's great, thanks. I'd certainly endorse those sentiments. I mean, I was a training program director in North Manchester in an urban environment, and then down in the southwest in Devon. Wherever you go, you're going to have an absolutely fantastic year. You'll meet lots of great new people, do new things in the vicinity. It's not gloom and doom in dentistry, as some people would have you believe. You're going to have a fantastic career and a great FD year. We are here to support you at the DDU. You've met a couple of the people who are very well placed to do that. So never hesitate to pick up the phone, and have a fantastic year. And we hope to see some of you at FD events, and either in person or online. So thanks for watching, and we'll look forward to seeing you shortly.